In her dream, Daniel Puckett is thin, and life is better. She isn't haunted by the memories of relentless teasing and losing weight, only to gain it back. Daniel Puckett is 18 years old, 5 foot 4 inches, and weighs 385 pounds, and is constantly struggling with high blood pressure, sleep apnea, asthma, and low self-esteem. There are many other stories just like Danielle's of children dealing with childhood obesity. So, who is to blame for this problem? In an article written by BBC News, Childhood Obesity, Why Do Parents Let Their Children Get Fat?, the parents are to blame for their lack of education in the types of food to eat and limit their money to buying healthy foods. Well, there are some to a right extent, but the environment is causing the parents to be less knowledgeable about childhood education. Childhood obesity has increased due to the unhealthy environment that American children are raised in. And unfortunately, like the waistbands of our nation's children and teenagers, it's set to get even bigger. The problem with childhood obesity in the United States has increased drastically over the years. According to a study done by the Centers of Disease Control, the percent of children and adolescents in the United States who were considered obese increased from 7% in 1980 to almost 18% in 2010. The United States ranks ninth in the world for the fattest country, with 74.1% of those who are 15 years or older considered obese. But our country ranks first in the world for the largest percentage of obese or overweight children. In the United States alone, 35.9% of girls and 35% of boys, all aging from 2 to 19, are overweight or obese. Mississippi has been known to be the fattest state in the country for over 3 years, and among children aged 2 to 5, 14.9% were overweight and 13.7% were obese. Along with the increased rate of obesity, the amount of physical activity that children are participating in has decreased, and the amount of watching television and video games has increased. Just like junk food, children are consuming more media and advertising than ever before. According to the Kaiser Family Foundation, children will spend an equivalent of 3 school years watching television before they even enter the first grade. Children are also strongly influenced by advertisements promoting foods and drinks. In a July 2009 study done by the Robert Wood Johnson Foundation, found that out of all the advertisements put on television viewed by children, 97.8% were for foods that were high in sugar, sodium, or fat. The media is not the only environment factor that has increased childhood obesity. There are many dwindling resources that parents just can't control. According to a graduate research done by the University of Minnesota, found that families of higher income and social class have better education, better medical and nutritional knowledge, and the ability to understand the information about the media and the unhealthy food that is being advertised to their kids. This doesn't mean that families of lower incomes can't provide a good environment for their children, because they can, but they're less knowledgeable about the foods that are being advertised. Children are also being affected by their physical and built environment. With some parents not having a high income and under-supported schools, it can be hard to afford fruits and vegetables because of the high cost. In an article published by the NWY Medical Guide, children are more likely to consume fruits and vegetables if they are available at home, in school, And with the availability of vending machines in school, it can develop bad eating habits in children. Schools and lower income families are not the only problem with childhood obesity, but poor neighborhoods have also become a problem for children. In a journal written by Katie M. Booth, poor neighborhoods have 3 times less supermarkets and have more fast food restaurants and convenience stores, limiting the availability of healthy food choices. Childhood obesity cannot be stopped altogether, but there are many states and organizations that are beginning to put in efforts to help with childhood obesity. According to U.S. Today, a 2010 law directed to the United States Department of Agriculture issued a law to update the national standards for all food served in schools. The law is directed to improve the health of about 53 million children who attend primary and secondary schools. Even the state of Mississippi has started to make changes to their lifestyle. According to the Preventing Obesity with Every Resource Power project, The state of Mississippi has been working at both public and private sector levels to reduce childhood obesity rates and other related chronic health issues affecting citizens. The Mississippi Department of Education has been putting in efforts to changing the legislative policy to improve the physical and health education in all of the 152 public school districts in the state. The American Heart Association has even created programs for kids to participate in and to also become healthier. According to Understanding Childhood Obesity, written by the American Heart Association, they have created 8 programs for parents to get their children involved in even schools and communities. One of these programs is Alliance for the Healthier Generation, and their goal is to reduce the nationwide childhood obesity problem by 2015. They are engaging with schools, leaders, parents, and even healthcare providers by educating them on making lifelong healthy eating habits. Childhood obesity has become a huge epidemic, not only in the United States, but it has become a problem worldwide. Children who are obese or overweight at a young age begin to develop problems including asthma, sleep apnea, and have a very high risk of diabetes. Could you imagine a 5-year-old getting diabetes at the age of and having to deal with it for the rest of their life? Childhood obesity cannot be stopped altogether, but there are many programs that are being put out there for parents to get involved. So this means that communities, schools, neighborhoods need to get involved with programs and also help children. There also needs to be programs for lower income families to support their children in a healthy way. As Daniel Puckett said, being obese is difficult. There's no way out. People think it's just easy and I should lose the weight. But I would like to tell them, try being in my shoes and see how it feels.